If you feel rapid emotions, uncontrollable thoughts, or different personalities coming out in different settings, you're probably just a normal human being. But if you experience extreme versions of these states, you might have dissociative identity disorder, or DID, and it can be a really scary experience. You might hear voices in your head that are trying to take control. When these voices or personalities take over, they might speak differently, like different activities, or even move differently. You might have gaps in your daily memory or your past and childhood. You might have seen examples of dissociative identity disorder in Hollywood in characters like the Hulk or in the movie Split or Fight Club. But what does switching personalities actually feel like? Some have a fair amount of control over switching, or you may not even notice that you're switching. Switching can make you feel anxious or even angry because it can feel terrifying. Some dissociative episodes can last hours or days, while others may last for weeks or months. And the creation of new alters can feel different from person to person. One person can feel like their mind seems foggy or dizzy or lightheaded, and some people feel cold and shiver or have feelings of detachment. Or your internal thoughts feel like they're getting louder and louder. It can be pretty scary, but don't worry, awareness is the first step. Have you ever wondered what causes dissociative identity disorder, or DID? First off, you aren't born with it. It typically comes from childhood and adult trauma. Most commonly, it's from being exposed to long-term physical, emotional, or sexual abuse. The mind and body respond reactively to stress, and the events we go through as kids have huge impacts on how we react and interpret the rest of our lives. When someone with DID is experiencing a lot of stress, they switch between personalities in order to cope. And we tend to experience stress all over the place. So new experiences, school, friends, family, or even just being reminded of the past can trigger switching. Memory plays a huge role in DID. Smells, sounds, or even taste can bring up past experiences that trigger an episode. The mind doesn't feel safe. It thinks it's in a harmful environment. It was in the past, so it reacts in the only way that it can protect itself, by disassociating with the present reality. There is no cure for dissociative identity disorder, but there are lots of ways to help you improve and live a beautiful and happy life. The most popular is psychotherapy, which focuses on how to cope with trauma to allow your personalities to rejoin and live together in a way that benefits them. It's kind of like becoming the director of actors on stage instead of just being in the audience. Medications can also be used sometimes alongside dialectical behavioral therapy, also known as DBT. DBT is another form of therapy that targets specific feelings that lead to make up destructive choices and give you coping skills to stay in control of your different identities. No matter what, in order to understand and to process your trauma, you need to get help from a trauma-informed licensed therapist. These therapists will be equipped to help communicate with and understand your alters. If you want to learn more about DID treatment specifically designed for teens and young adults, go to sandstonecare.com or call the number linked up in the description box. We'll get to know you and your specific situation and connect you with the support that you need, even if it's not with us. Change is possible, and Sandstone Care is here to help.